Thank you, Mr. Chairman. And I would like to thank Ann Hazlett. Thank you so much for your service. It's always great to see a fellow Hoosier here in the committee. Before we get into the questions, I want to thank you for your service to the people of Indiana and to the country. I'm sure you'll make all of us proud in your new position at USDA. I want to ask you also about an issue that I know is dear to your heart and mine, and to many Hoosiers and to all of us. I know you're aware of the difficulties that many of our communities are having when responding to the challenges of addiction. I've been working with a number of members on the committee and trying to ensure that USDA has the resources it needs to help our rural communities respond more effectively. I've been fortunate to introduce a pair of bills with Chairman Roberts and Senator Strange, and I want to thank them both for their partnership to help provide rural communities with what's needed. Opioids and substance abuse impact every community, but accessing treatment is even more of a challenge in some of our rural areas, as you know, across our state too. Can you discuss how USDA's community facilities and telemedicine programs will help rural families and rural communities address the crisis?
Thank you, Senator Donnelly, for raising this important issue and for your leadership on it. Both of the programs that you highlight are certainly being used well right now to address both providing treatment facilities in communities as well as using innovation through telemedicine to access those services that might not be located in the immediate town. Certainly, Mr. Davis can go into specific numbers that we have with those programs. I think one of the things that I'd like to circle back to that I'm excited about, mentioned in my beginning remarks, the Innovation Center that Secretary Perdue intends to create. I think this is a good example of an issue that for communities that are finding themselves in the crosshair for the first time and want to know what has worked well in other places, whether it's through treatment resources or some of the other ways that a rural community might have a unique asset that can be leveraged to address this challenge. That's a great example of where best practices are something that the Innovation Center can then disseminate in so that communities do not feel alone.
Ms. Hazlett, also, I'm sure we both agree that substance abuse and addiction education and prevention programs are really critical to ensure we're not only treating the symptoms, but also working to prevent it from occurring in the first place. A program you're aware of, Purdue Extension, which has great reach into our rural communities around the state. They offer families substance abuse prevention programs like Strengthening Families Program, which has been shown to lower levels of substance abuse in younger people. Can you discuss how important for rural communities programs like these are for their families?
Absolutely. I've actually had an opportunity to see that program firsthand on the ground in Scott County, Indiana. And I think one of the great strengths of a program like that is that it is looking at some of the underlying causes that lead for many of these situations, lead families into many of these situations. When we look at those types of programs, I think we're not just changing that immediate situation, but we're potentially changing a generation, and we're having a broader community conversation about factors that need to be addressed to have prosperity and quality of life in these areas. Things like public transportation, food security, literacy rates. It becomes a catalyst for a broader conversation that will result in stronger communities and a stronger rural America for the future.
Thank you, Ms. Hazlett. Thank you, Mr. Chairman.